I'm Angeline. I'm one of the renal dietitians at an NHS trust in Devon, but I'm actually coming to you from Birmingham this evening, where I'm at a conference. It's a UK Kidney Week here in Birmingham. So I've been at a conference all day today and had some wonderful talks, one of which was on plant-based diets in CKD. So it's been a good day for plant-based diets. So this evening, I'm going to talk about the role of the kidneys, just very briefly, what CKD is, as in chronic kidney disease, and the stages of CKD and the risks that CKD progresses through. So the risk factors that cause progression of chronic kidney disease through to what's known as end-stage kidney failure or end-stage renal disease. There are some current dietary guidelines that I'm going to talk through as well. And I want to really talk about the effects of a plant-based diet on CKD. And anyone who knows anything about kidney or CKD will know that potassium and phosphate considerations will always come into this. So I'm going to talk about those as well. So briefly, the role of the kidney isn't just there to produce urine, it has lots of little jobs, it does. So it balances our electrolytes in the body, so things like potassium and phosphate, hence its importance, calcium, sodium and magnesium too. It deals with removal of waste from our body, so general day-to-day metabolism and food waste. The kidneys will filter that waste out for us. And it's part of our acid-base balance as well. So our body can become quite acid through day-to-day metabolism. So it helps maintain the levels in our body. It helps manage the fluid levels, hence the need to pass urine. It's involved with our blood pressure control. When we absorb vitamin D from sunlight, our kidneys are part of activating that so that it can be used by the body. And it also helps with making our red blood cells. So lots of jobs, not just producing our wee. But what is CKD? So the definition of CKD is a reduction in your kidney function. Or a structural damage to your kidneys that's been present for 3 months or more with some sort of associated health implications. And it affects about 10% of the global adult population. And in the UK, it's thought that about 3 million people are living with CKD. And the cost to the NHS is about 1.5 billion per year. But the cost to your people personally is far, it's far greater. It has huge implications for your life, your career, family. So it's not just about the financial burden. In terms of the leading causes of CKD, diabetes and high blood pressure are the current leading reasons for chronic kidney disease. And when chronic kidney disease progresses, it becomes renal failure or kidney failure. And at that point, in order to sustain life, dialysis or a kidney transplant is required. And with CKD, there is an increased risk of cardiovascular disease. And similar to diabetes and high blood pressure, hypertension, those also carry an increased risk of cardiovascular disease. So to add CKD into the mix as well, the risk increases. So when we talk about CKD, there are stages of CKD, and it's worth just briefly talking through these. So you've got stages 1 through to stages 5. So stage 1 is the early stages of CKD. And these stages are measured by something called an eGFR. So you can see just to the side, GFR. So that's the rate that your kidneys are filtering your blood. And then you can see there's a number associated with each stage. So for example, it's stage 2, which is a mildly decreased kidney function. Your kidney function is at 60 to 89. And you can loosely interpret that as a percentage. So you could say 60 to 89% kidney function. And then the other category of measuring kidney function is also along the top here, A1 through to A3. And this is called a heat map, this red, orange, yellow and green, these colors here. And it's an indication of how much albumin urea you're passing when you pass urine. So albumin urea is essentially just a protein. So it's protein that's being passed in the urine. And we all pass a little bit of protein. But when we start to pass too much, then we start to damage the kidneys. And the more protein in the urine, the greater the damage and the faster the progression through these stages of CKD from 1 through to 5. For the purpose of the presentation, I'm really just going to be focusing on these 5 stages. I'm not really going to be looking at dialysis. That could be a whole presentation in itself, as could transplantation. And those people on dialysis or with a kidney transplant have access to a kidney dietitian, so could get advice personally. In terms of those progressing through those stages, there are certain risk factors that will take you through the stages. So diabetes being one of them, high blood pressure, heart problems or having a stroke, being overweight will increase your progression through those stages, as well as smoking. Those are the lifestyle factors. There's of course things like family history, and as we age, our kidneys will naturally decline, but obviously we can't do a great deal about those. The aim really with any dietary lifestyle changes is to slow down this progression so that we can prevent end-stage kidney failure. Before I talk about the diets for CKD, I just want to talk about some of the research that's being done around dietary patterns and the link to developing CKD. This is a bit of a busy slide, but it's from a paper that's a review. It's a meta-analysis review of 18 studies, and it covered over 600,000 adults over an average of 10 years. And it looked at dietary patterns and the link with developing CKD. And what was found was those that ate a high intake of fruits and vegetables, legumes, nuts, whole grains, fish and low-fat dairy had lower risk of developing CKD. And those that ate more red meat, processed meat, sodium, salt, or sugar-sweetened beverages, their risk of developing CKD was a lot higher. And there was a higher link with that albumin urea, so that protein in the urine, which takes you through the stages of progression towards end stage. There were a few other studies I just briefly wanted to mention. So here the incidence of CKD was looked at in a few studies. So the potential for developing it, there was a study where it had 5,000 patients, and they found that plant-based proteins were associated with a lower risk of CKD, while animal proteins may be a risk factor for CKD. This second study, the Singapore Chinese Health Study, looked at 63,000 patients over a 15-year period, and red meat intake was strongly associated with CKD, developing CKD. The AIC study with 12,000 patients reported that red and processed meat was associated with the risk of developing CKD. And interestingly, substituting 1 serving of red meat in the diet with 1 serving of legumes was estimated to reduce the risk of developing CKD by 31%, which is quite a significant number. So in terms of studies that have looked at progression, this is just one I want to mention. So the Nurses' Health Study looked at non-dairy protein, so your meat, your fish, linked to decline in kidney disease. And so it showed a link that there was a decline in kidney disease, and that link was dose dependent. So the more of those foods that were eaten, the faster the progression. And then moving on to what our current dietary guidelines are. So you may or may not be familiar with these. So these have come out from Kudoki and also KDIGO. So could make up a song about it, really. Kudoki and KDIGO are international guidelines. And the current guidelines came out in 2020. Prior to that, the last set of guidelines were in 2000. So it's been a 20-year gap between these guidelines. And during that time, they looked at evidence between 1985 and 2016 in order to produce these guidelines today. And you can see here that the advice for patients or adults with CKD 1 to 5, not on dialysis and without a kidney transplant, is to follow a Mediterranean diet. And this is for those with or without dyslipidemia. And dyslipidemia is essentially high cholesterol. And we've also got another set of dietary guidelines here that's specific to those with CKD and diabetes. And that came out of the clinical practice guidelines for diabetes management, again, from KDIGO. And it states very clearly that patients with diabetes and CKD should consume an individualized diet high in vegetables, fruits, whole grains, fiber, legumes, plant-based proteins, unsaturated fats, nuts, and lower in processed meat, refined carbohydrates, and sweetened beverages. So it links really nicely with some of the evidence that we've looked at before coming to the guidelines. In terms of defining what a plant-based diet is, there's no recognized definition. In one particular paper by Carrero, he talks about all diets. Plant-based diets, essentially, it means all diets that emphasize the consumption of plant foods, fruits, vegetables, nuts, seeds, oils, whole grains, legumes, and beans. And it may or may not include a small or moderate amount of meat, fish, seafood, eggs, and dairy. And then when we look at the definition of a Mediterranean diet, which is what's being recommended by KDIGO, you would term that a plant-based diet. Essentially, it's one, again, that emphasizes large numbers of servings of fruits, vegetables, legumes, nuts, olive oil, and fish, and low servings of meat, seafood, eggs, dairy, and processed foods. So essentially, the Mediterranean diet comes under the umbrella of a plant-based diet. And why is that helpful in CKD? Well, first of all, let's just look at plant-based diets, what they can do for your general health. And the British Nutrition Foundation have summarised that really nicely. Plant-based dietary patterns with an emphasis on plant foods have shown them to be linked with reduced risk of heart disease, strokes, and type 2 diabetes. And if we think about the progression risk factors, then it's very appropriate. It helps with lowering those risk factors. In addition, they say, healthy plant-based diets can have beneficial effects on lowering blood pressure, reducing blood cholesterol, and promoting a healthy weight. So further risk factors for the progression of CKD that it's benefiting. But there's more to it than that. In CKD, there are other benefits. So we're going to look at those, and we're going to look at saturated fat and cholesterol and why that makes a difference in CKD, why it might lower salt and how that's helpful, why it increases fiber and how fiber is helpful. Acid, we're going to look at how it lowers acid in the blood and how that's helpful. Plus, we're also going to look at plant-based diets and how they're beneficial for protein intake, lowering phosphate, and lowering potassium. So I'm going to start with cholesterol and saturated fat. So dyslipidemia or cholesterol is common in CKD. It's not unusual to see somebody with CKD and a high cholesterol. Individuals with CKD have higher rates of cardiovascular disease, as I've already alluded to, and cholesterol is a contributing factor to that, along with high blood pressure, excess weight, and diabetes. Saturated fat is a contributing factor to a raised cholesterol, and that is well documented. But also, really interestingly, studies have also shown that a higher intake of saturated fat is significantly associated with the presence of a higher amount of albuminuria, so that protein that's filtered out in the urine that damages the kidneys on the way out. So that's where it's relevant to CKD. But if we look at which foods contain saturated fat, it's of course, majority of them are animal-based, so things like butter, ghee, lard, suet. We've got some plant-based sources there as well. Fatty meats and processed meats, dairy products, milk, cheese and yogurts. And then we've got things like pies, pastries, cakes, biscuits. These are all high in saturated fat and will increase or potentially will increase cholesterol in the body. And it's thought that actually almost 75% of the adult population overconsumes on the recommended amount of saturated fat. So anything we can do to bring down these types of foods and replace them with these types of foods over here in the foods that can lower cholesterol. So there's something called the Ultimate Cholesterol Lowering Plan, which you can find on the Plant-Based Health Professionals website, and it's also available on Heart UK's website. It essentially promotes a healthy, balanced diet high in high fiber foods, vegetables, fruits, whole grains and legumes. But it also talks about certain foods that can actively lower cholesterol. So soya foods, so soya milks, yogurts, tofu, tempeh, nuts, a handful of nuts, and we're talking about plain unsalted nuts here, can help lower cholesterol. And then there's a particular fiber in oats and barley, which can also help lower cholesterol. So it's clear here that our animal-based foods, which are high in saturated fat, push up our cholesterol, and our plant-based foods, lower in saturated fat and much higher in fiber, can help lower our cholesterol. So less cholesterol, less saturated fat, less proteinuria. Okay, I'm going to move on to salt. Got quite a bit to say about salt. It's a big topic with CKD. So I've got some guidelines up here again. Sodium intake and blood pressure. So in adults with CKD 3 to 5, it's recommended limiting salt. And they've given a number there, but what I've done is made that more relatable. So it's essentially less than 5 grams, which is about a teaspoon. We don't need to be aiming for that. We want to be less than that. And that can help with blood pressure control. That's pretty well established, but what you may not be aware of is that also in adults with CKD 3 to 5, again, that same recommendation exists, and that's to reduce the proteinuria, that protein in the urine. So when there's too much sodium in the blood, then that has to be filtered out by the kidneys, and it takes with it protein, which will damage the kidneys. But is a plant-based diet low in salt? So let's look at that. Does it mean that you're having less salt if you're eating a plant-based diet? Well, plant-based diets can be naturally low in salt when you're not using the highly processed foods and you're cooking more from scratch, which is very much what I would advocate. And you're more likely to reduce very naturally salty foods such as cheese, ham, smoked meats, and processed meats such as sausages, bacon, or salamis. And a plant-based diet would encourage more natural sources of protein, so beans, lentils, peas, nuts, over more processed plant-based alternatives. And there's a very good reason for that. There was a survey that was done by Action on Salt in October 2018, where they looked at the salt content of over 150 meat alternatives and found actually that the meat alternative version had more salt in it when compared to the beef, or it was a beef burger and a veggie burger. So when comparing those, the beef burger had less salt than the meat-free alternative. That's not to say that you can't have or you shouldn't have those foods. What you really don't want to be doing is making them the daily alternative to meat. So how do we use less salt? Okay. Number one would definitely be cooking from scratch. And when you are cooking from scratch, try and use minimally processed ingredients. Use fresh tinned or frozen vegetables with no added salt. So although you can still buy vegetables tinned, go for those that are tinned in water and avoid those with any salt added. I really avoid adding salt during your cooking as well, and try to flavour your foods with more fresh or dried herbs, spices, peppers, garlic, ginger, lemon, lime, vinegar. It may require a little bit of experiment and following recipes for a while, and I can talk about that later. But you'll essentially get used to a different flavour of food, and try tasting your food before adding any salt at the table. I would always advise not adding any salt at all at the table, but that may be something that you'll have to gradually reduce. Cutting back on high salt sauces such as soy sauce, ketchup, brown sauce, salad creams, or salad dressings. They're okay to use, but just use them in very small amounts and use them less often. There are some very low salt stock cubes now available in supermarkets. There's two really well-known brands, and they don't have any nasty additives, and I'm going to talk about additives later. But you can go for very low salt stock cubes, and there's also ones that have zero salt stock cubes as well. Or you could be very adventurous and make your own low salt stock. And remembering that it's not just, the salt that you get in the salt shaker, there's other salts that are also included here. So sea salt, rock salt, garlic salt, pink Himalayan salt, any sort of salt that all has the same effect on the body. Stick with it because your taste buds will adapt and they will change. And in time, you'll get used to tasting the flavour of the food rather than the salt. And one of the things I would highly also recommend is learning how to read nutrition labels. And there's a fantastic leaflet that you can download from the British Heart Foundation, which has this little table that's here at the top, which has the traffic light parameters for the labels that you look at on the back of packaging. So you quite often see these on the front of packaging and it's got a lot of numbers on, and sometimes it can be quite meaningless. But if you turn over your food item and you look at the labels on the back, you get a little bit more information when you compare it to this table. So if we briefly look at these two food labels here, on one side we've got a vegetarian burger, and if we scan down to the bottom here, it's got the amount of salt per 100 grams. That's the important thing to look at. Per 100 grams, it has 1.1 grams of salt. And then if you compare the salt on the table with the traffic lights, you can see that falls into the amber, the medium category. And then if we look at this bag here of red lentils, we have salt at the bottom again. That's normally where you would find it. And it's per 100 grams, scanned down, 0.05 grams of salt. So it's very clear that natural forms of plant-based proteins are much lower in salt than any processed forms of plant proteins. There's another really useful resource that I do want to share with you as well, which is a free app that you can download. It's been produced by Action on Salt, and it's called Food Switch. And it's really handy because you can use it when you're in the supermarkets comparing labels. And certainly if you get a bit lost reading labels, or perhaps if your eyesight isn't great, you can scan the barcode of a food item, and then you can, it will tell you if it's got alternative options that would be lower in salt for you. I'm going to move on to fibre now and talk about how more fibre in the diet can be helpful. So fibre is only found in plant foods. Animal foods are completely devoid of fibre. And in the UK, it's recommended that we have 30 grams of fibre a day. Fibre's got many roles in the body, so it helps with our bowels, keeps us regular, can help reduce cholesterol, slow down glucose absorption, so the sugars in the bloods that's absorbed from food, it can slow that down, which can steady our blood sugars. It can help with satiety, so help with feeling full, and therefore it's useful with weight control. And in the general population, in fact, the increase in fibre consumption has been associated with lower levels of cholesterol and with a healthier body weight. The current UK intake is about 18 grams of fibre a day. So not very close to our 30 grams that we should be aiming for. And interestingly, in a study, they looked at the fibre intake from different types of diets. So a meat-based diet, it tended to be around 23 grams a day on average. In the vegetarians, 37 grams a day, and in vegans, 47 grams a day. And it was thought that the vegetarian and the vegan diet, that the fibre came from whole grains, vegetable fibres and pulses. But what are the benefits in CKD? So this is where it gets a little bit complicated, but it's really worth learning because it is really interesting. So the benefits of fibre in CKD is it helps with our gut bacteria. So we've got trillions of bacteria that live in our gut, and some are good and some are not so great for us. And the food that we give our gut bacteria is, it likes to eat our fibre. So the good bacteria thrives on the fibre. Now, uremic toxins are generated by our gut bacteria when we digest and metabolize protein. So uremic toxins are toxins that the kidneys would normally have to filter and get rid of from the body. It's a toxin, essentially. We don't want it. Uremic toxins are associated with faster progression of CKD. Now, we know that with plant-based proteins, legumes, nuts and seeds, they're associated with less of those uremic toxins. So our body makes less of them, the bacteria essentially makes less of them when we compare that to animal proteins. And that's because those plant-based proteins are wrapped up in a lovely coating of fibre. In addition, the fibre present in those plant-based proteins helps to bulk up our stools, so we're more likely to pass more poo. And when our bowels are opening, and they take with it these uremic toxins. So the more we open our bowels, the more toxins we lose through our bowels as well, which means these toxins never get into our bloodstream, which means that the kidneys don't have to filter them. So it's less work on our kidneys. It takes the pressure off the kidneys. There's a really interesting picture here. I hope I don't lose you at this stage, because stick with me. It does look a bit complicated, but it's a good one to understand. So in figure A, so here where we've got some animal protein going in, there's a certain type of bacteria that will ferment that animal protein, and through fermentation, the bacteria will then produce, from the animal protein, it will produce these uremic toxins. And those uremic toxins start to damage the lining of the gut. So this blue bit along here is the lining of the gut. And you can see these little links between each section of the gut. They're starting to break down. And what that's doing is allowing those uremic toxins through the gut barrier into the bloodstream. And that means that it's making its way to the kidneys. what it does is it increases our rate of inflammation. And inflammation is very closely linked with progression of CKD, but also progression of cardiovascular disease as well. When we compare that to the fiber side, so this is pure fiber, so we've got a piece of fruit going in here. That fiber is fermented by a completely different bacteria. And instead of producing these uremic toxins, it produces these lovely short chain fatty acids. And those short chain fatty acids have protective roles, and they help to protect that barrier. So there's no breaks in that barrier in the gut, which helps with things like insulin sensitivity. It also creates an alkaline environment and reduces inflammation and reduces acid. And we're going to talk about acid next because that's really important in CKD. So if I go on to talk about acid, then hopefully this will make a little bit more sense as well. So acid, we've got a pH scale across the top here. So we've got acid, the acid level is 0 to 6. Neutral is 7, alkaline is 8 to 14. So your body needs the right balance of acid and alkaline in order to function properly, and your kidneys along with your lungs are responsible for doing that, and that's called your acid-based balance. Now, acid and alkaline levels are measured on that pH scale that we've seen across the top. So an increase in acid means that your pH will fall to either that 1 to 6. And an increase in alkaline means your pH level will rise to the 8 to 14. So the normal body level is 7.35 to 7.45. So we are just slightly alkaline. Now, the pH or alkaline level in your body is partly determined by the foods that you eat. It's also determined by other metabolic factors, but the food that you eat can determine the acid in the blood or the alkaline in the blood. And foods are either acid forming or alkaline forming. And when the levels of acid in your blood are too high, that's called acidosis, and that's quite common in CKD to find somebody who has a higher level of acid. Now, in the general population, higher acid load, more acid-forming foods is related to the higher risk of developing CKD. And then if we look at the CKD population, if there's more acid, a higher acid load going into the body, then that's related to a faster decline in kidney function. So it takes you through those progressions of those CKD stages. So if we look at the foods that might affect your acid or your alkaline, you can clearly see that your fruits and vegetables here are your alkaline forming foods. So animal foods are more likely to are more acid forming, and your fruits and vegetables are more alkaline forming. Now, plant-based proteins will be more acid forming, but they're less acid forming than animal proteins. So if we look again at these KDIGO guidelines, it's recommended that in adults with CKD 1 to 4, that we prescribe, you don't need a prescription for this, but we prescribe an increased intake of fruits and vegetables. First of all, to decrease body weight, help with blood pressure, but to help with that net acid reduction. So again, fruits and vegetables are really important because of reducing the acid in the body and taking the pressure off the kidneys. They no longer have to reduce the acid for you. Okay, we're going to move on to protein now. So protein in CKD, it's well known that a high protein intake has been shown to impair kidney function. And in 2 large recent studies and 1 review, it highlighted the damaging effects of high protein intake on the progression of kidney disease. And several studies show that a lower protein diet reduces proteinuria, that protein in the urine or albumin urea. So we know that the average daily intake of protein in the UK is 76 grams a day for adults 19 to 64 and 67 grams a day for adults aged 65 and over. However, the recommended amount of protein for an adult is around 45 to 56 grams of protein a day, and that's based on an average body weight of 60 to 75 kilograms. And we work out the amount of protein we need by taking this 0.7 grams of protein and multiplying it by the weight. So we're clearly overeating on protein. Looking at this, it's around 20 grams of protein that we're eating more of, and possibly more than 20 grams of protein in some cases per day. Okay, so if we look at the protein in animal foods versus plant foods, when we look at the amount of protein in animal foods versus plant foods, it's quite clear that the plant foods are lower in protein gram for gram. For example, 100 grams of meat contains around 25 grams of protein, you can see over here, while legumes have around 7 to 10 grams. So swapping, for example, a chicken curry for a chickpea curry, or a beef bolognese for a lentil bolognese, you're naturally lowering the amount of protein you're eating, and you're less likely to overeat on your protein. And that can help slow down the kidney progression. There is some guidance about lower protein diets in CKD, but they would require the support of a kidney dietitian. So if that's something that you're interested in, it's worth talking to your kidney dietitian about that. In terms of just summarizing the benefits of plant proteins over animal proteins, we know that it's going to decrease the dietary acid load. We know it's going to increase the fiber, which could improve your gut motility and promote a healthy gut bacteria, which would lower those uremic toxins. It's going to reduce saturated fat, which in turn reduces cholesterol, but also reduces albuminuria, so that protein in the urine, which is damaging. But it also increases things like phytonutrients and antioxidants, and those are like plant chemicals, but they're protective plant chemicals that help lower inflammation in the body. And so that protects you from cardiovascular disease as well. And as we've seen, it may be helpful in lowering the amount of protein that you're getting in the diet, which is again protective for the kidneys. And it will prevent you from perhaps overeating on protein. So we're going to move on now to potassium. And so a lot of you are probably saying, if you know anything about traditional renal diets, which have always been quite restrictive of fruits and vegetables, how are we going to deal with this potassium? So let's first of all describe what potassium is. So it's a mineral, it's present in many foods. And it is needed for everyday function. In the general population, it's protective of the heart. When the kidneys are working normally, then your kidneys will filter out any excess potassium, as you saw at the beginning when I talked about the job of the kidneys. They filter out, they balance your electrolytes, potassium being one of them. And unfortunately, when your kidneys aren't working properly, that filtering system doesn't work, and so potassium levels can start to build up in the blood. And you can see here I've written that that's normally in the much later stages, and it doesn't mean that it's going to happen. And I quite often, and it's very common for me to see patients that that never experience a high potassium level, despite what level the stage of CKD they're at. However, when you do experience a high potassium level, that can be dangerous, and it can interfere with the workings of the muscles, including the heart. To keep potassium safe, some people are advised to follow a low potassium diet. Now, it's really important that I point out here that there's no benefit in following a low potassium diet if you do not need to. In fact, it can be quite detrimental because it could exclude some very healthy foods. I have seen patients with very, very early stages of CKD that have excluded potassium, thinking that they're doing their kidneys good. Unfortunately, that's really not the case. So only follow a low potassium diet if you've been advised to. Okay, I want to talk a little bit more about potassium. So traditionally, fruits and vegetables, as I've said, have been restricted in a renal or kidney diet, and that's to control potassium. In fact, in one study looking at a range of low potassium diet information provided by health professionals, the advice primarily restricted fruits and vegetables. When actually in another study, the top 4 sources of potassium in the US diet was beef, chicken, Mexican food, and hamburgers. So why is it that we are restricting fruits and vegetables? Well, in a plant-based diet, there's no evidence to show that it increases potassium levels. And why would that be? Possibly fiber, possibly potassium additives. So I'm going to talk a little bit about how fiber helps and what potassium additives are. So fiber, again, we know that plant foods contain fiber and animal foods are completely devoid of fiber. They have no fiber. Fiber-rich foods mean the potassium is more difficult to digest, therefore we're less able to absorb it. So the fiber sort of holds on to the potassium, if you like, number one. But also number two, excuse the pun, but the more fiber we eat means more stools, more poo, essentially. And when we open our bowels, we take with us potassium. So we can lose potassium through the bowels as well. And we're more likely to open our bowels if we have more fiber. So that's why fiber is helpful. And potassium additives, well, if we look at potassium additives, they've been introduced in recent years to lower the salt content of many foods. So it gets a little bit confusing for renal patients because you go for the lower salt variety, but sometimes these can be high in something called potassium chloride, and it's because it's got that salty taste. And often they're allowed to replace up to 25% of the salt in processed foods with this potassium chloride. But it's also in other potassium, in other preservatives, antioxidants, stabilizers, flavor enhancers as well. In fact, in one study, examining foods commonly, they found that 1 in 11 foods contained potassium additives, and that salt reduced products had 44% more potassium than the original, and that potassium additives could increase the content of potassium by 2 to 3 times the original product. And then when we think about potassium additives, they're not wrapped in fiber like fruits and vegetables are. Potassium additives are very easy for our body to absorb. They're not attached to fiber, which stops them from absorbing, and also they're not attached to fiber, so we don't open our bowels more often and release it. So we absorb the potassium from these additives very easily. And of course, they're more often than not, they're added to very processed foods. So what should you do if you need to follow a low potassium diet? Okay, first of all, you would only really need this in the later stages, not in the early stages, and you should only follow it if you've been advised to. And you should have individual guidance from a kidney dietitian. Do not take this as guidance today. I think if you get guidance from a kidney dietitian, one of the first things that they'll probably look at is other causes other than diet. So is it your medication, and can that medication be changed? Because some medications will increase potassium. Is your diabetes well controlled? So if you have high blood sugars, that can affect potassium. So that's because insulin is involved with lowering potassium. So if there's not enough insulin in the body, then the potassium can be too high. Again, bowels, coming back to why fiber is really important. If you're constipated, then you're more likely to have a high potassium. And if there's some of that acidosis, so if your acid levels are too high, and again, remember, acid comes from animal foods rather than from plant foods. So first of all, I think a dietitian would want to look at those causes with you. And then they might look at limiting potassium additives. So you might need some advice and guidance about where they might be coming in your diet. Other things that they might progress through is looking at coffee. Coffee is very high in potassium, and I've known patients to drink 12 cups of coffee a day. and think nothing of it. So limiting coffee may help, limiting milk and milk products, or considering replacing milk and milk products with the plant-based alternatives, but bearing in mind that some plant-based alternatives have a potassium additive. So you would need guidance from a dietitian on this. Limiting things like fruit juice, vegetable juice and smoothies and dried fruits. And then when we get to the fruits and vegetables, it wouldn't necessarily be restricting fruits and vegetables, but it may be that you would need to swap some of the high potassium fruits and vegetables for some lower potassium alternatives. And finally, looking at things like your cooking methods. So we know that when you boil vegetables, the potassium leaches out into the water. And then when you discard that water, you're essentially getting rid of some, not all, of the potassium. Okay, moving on, I'm going to talk about phosphate. So phosphate, again, is a mineral, and it's found in all protein foods, and it's also found in whole grain foods, and it's added to many processed foods. Just like potassium, it's an additive as well. Phosphate is used with calcium to make healthy bones, and again, in healthy kidneys, if we have too much, that electrolyte balance means that your kidneys will filter out what it no longer needs. But when your kidneys aren't working, that phosphate level isn't filtered out, or that it's not filtering out enough, and so the phosphate levels in your blood start to build up, and that can be dangerous more from a longer term health point of view, because it starts to weaken your bones and harden your blood vessels. So you may be advised to follow a low phosphate diet or take medication called a phosphate binder. So if we look at the foods that contain phosphate, again, I said it's the protein foods. So you've got legumes, cereals, nuts, milk products, meat, fish, eggs, and then we've also got phosphate additives. What's important here is if we look at how these foods are absorbed. So legumes, cereals, and nuts, our body tends to absorb about 20 to 50% of the phosphate. And that's because, again, it's bound to fiber, but it's also bound to something called phytates, and we don't have the enzyme to break down those phytates. So they just basically pass through our bowel. Whereas animal products, so milk products, meat, fish, and eggs, we absorb more of these, about 40 to 60%. And then here, as we come up to the phosphate additives, we can absorb anywhere between 90 and 100%. So these are ones to avoid, and of course they're added to many processed foods, as you can see here. So many baked goods, processed meats, dairy, so sort of processed cheeses, alcohol, and dark fizzy soft drinks. So what to do if you need to follow a low phosphate diet? Again, you should have individual guidance from a kidney dietitian. You could start here by limiting processed foods, because you then avoid your phosphate additives, so cooking from scratch where possible. Of course, protein is essential, so it will contain some phosphate, but plant-based sources of protein such as beans, pulses, lentils, nuts and seeds have lower absorption, so consider more of those. And then dairy foods such as milk, cheese, milky puddings, yogurts, ice creams, they're much higher sources, so consider the plant-based milk alternatives. Although some of them will contain phosphate additives, I think what you've got to do is weigh up the balance of the fact that they can help lower cholesterol and they have less saturated fat in them. Okay, so summarising all of that, you could enjoy a plant-based diet of minimally processed foods that are low in salt, because it supports a healthy weight and diabetic control, lowers cholesterol and cardiovascular disease risk, as well as lowering protein or albumin urea. It lowers salt intake and may lower blood pressure and albumin urea, provides more fiber, lowers uremic toxins, can lower acid in the blood and slow down the progression of CKD. It can lower protein and slow down the progression of CKD. As we've seen, it could help manage potassium because it's got more fiber, and therefore it would allow you to eat more fruits and vegetables, and it could also help to lower phosphate levels as well. How would you put that all into practice? This is a lovely image again from the KDIGO guidelines. This came from their diabetes update guidelines in 2021. Whichever type of plate you use, ideally fill half of it with fruits and vegetables, the other half divide between whole grain, starchy carbohydrates or starchy vegetables, such as minimally processed potatoes, and then your protein from either animal or ideally plant-based sources. The take-home message for me is to eat a well-balanced diet rich in vegetables, fruits, whole grains, nuts, seeds, legumes, and keep animal proteins low, limiting red meat and processed meat, and where possible, cook from scratch. Limit those processed or convenience foods to lower your salt and additives. Avoid adding salt at the table and learn how to read food labels. Seek advice from a dietitian if you need to manage potassium and phosphate. Few considerations. It's not unusual for people with CKD to develop a poor appetite or to lose weight unintentionally. So again, seek support from a dietitian. And the need for supplements will be individual. And so again, seek support from a dietitian. I just want to tell you about one final thing, and it's a lovely resource. It's something I've been involved with a national charity called Kidney Care UK. It started about 4 years ago, and I've been privileged to be part of it since it started. It's a wonderful resource, and it's received approval from the RNG, the Renal Nutrition Group, and you'll find a range of recipes, and they're all with no added salt, and they're created by chefs, so they're delicious. They're analysed by dietitians, and we highlight ones that are low in potassium or phosphate if that's what you need. If it's just learning how to make delicious food with less salt, or even learning how to cook from scratch with less reliance on convenience foods, then it is a great place to start. All of the recipes are being beautifully photographed. There's step-by-step instructions. Some of them even have an accompanying video as well, so it takes you through the whole process. There's about 70 recipes online at the moment. There are probably around more like 140 that we've done so far, so there will be more added to the website. There is a recipe book with about 40 recipes in it, and that's available to all kidney dietitians across the country. They can get those for free to give to their patients for no cost. Thank you very much for listening. These are my references for anybody that is interested. Please do ask away any questions.
Thank you so much, Angeline. I think we almost are at 8 p.m, so we have some incredible questions, but your talk was so comprehensive. I think a lot of them have been covered, but I am going to ask a few. I'm also going to just launch this quick poll for anyone who has to leave early. We will go on for another 10 minutes, I think, if that's okay with everyone, is to answer that. But I would love to know a little bit more about the health inequalities. I know that in your practice area of Devon, you don't see such a wide variety of different.
No, I really don't. But I have worked with some people, particularly through Kidney Kitchen, who have created some Afro-Caribbean recipes for us, and they live in London and talk about how, you know, the CKD population in London, 50% of them are from ethnic minority groups. And as I mentioned earlier, I'm here at UK Kidney Week in Birmingham at the moment, and today we've had some wonderful talks about health inequalities. It started with Michael Mermott, who has written some fantastic books and really talks about, you know, political change is needed to improve health inequalities across the board, not just for ethnic minorities, but, you know, for socio-economic issues as well. We've had Kidney Research UK here today, and they've talked about many health inequalities, particularly with the more ethnic minority groups. They mentioned a figure of South Asian people with diabetes are 10 times more likely to develop end-stage kidney failure than their white counterparts, which is quite astonishing. And that, you know, there's faster progression in those from Black and South Asian communities. They progress through those stages of CKD faster than their white counterparts as well. So there's a lot of research. Kidney Care UK are doing an awful lot of research into this area. And there was a wonderful lady that gave a talk today. She's a peer educator, and this is something that kidney research are doing. So they're using peer educators who come from that particular community, be it Afro-Caribbean or South Asian, where they of course share the same culture, faith, language, and they're almost like trusted individuals, and so they're there to educate people on renal disease and how to manage it and the risk factors associated with it and the importance of managing those risk factors. So I think they're doing an awful lot of work. We had a wonderful talk from a woman who'd set up her own website. It's Warriors, Survivors and Heroes, but it's WSHBME Kidney Network, worth checking out if anybody's interested. And there's a large research trial underway which is addressing inequalities in renal research, and that's called Antenna, if anybody's interested in being part of renal research as well.
Fantastic. So there are a few questions I would love to.
Oh, of course, yeah, fire away.
Which comes up a lot of times, I've seen it, but there is, the person's asking, are there any concerns relating to plant protein powders and kidney issues? So I assume that relates to things like brown rice protein, hemp protein, pea protein. You see a lot of different blends out there on the market.
Yeah, I suppose the issue comes where you might be overdoing it on the protein. And I would always say try and get your protein from natural whole food sources rather than protein powders. So there's the potential, because they're high amounts of protein, aren't they, these protein powders? So there's the potential that you could overeat. And as we saw, as a nation, we eat too much protein anyway. We need far less protein than we're already eating. And also, as we saw, higher amounts of protein can damage the kidneys. So when protein's metabolized, it's metabolized down to urea, and that urea is essentially a toxin in the body, and it has to be filtered out, and it's filtered via the kidneys into our urine. So the less stress and pressure we can put on our kidneys, the better. So try and get your protein from natural sources rather than powdered.
That's really helpful. No, it leads on very nicely to, there's another protein question about the kind of what's been happening on Twitter and Twitter debates, that there are a number of doctors and nutritionists claiming that higher protein load is not damaging to the kidneys, and the recommendation of 0.8 grams of protein per kilogram is too low, not supported by recent evidence. We should be getting at least 1.2 grams per kilo at the very least. Is it in
CKD or in the general population?
So the question was, is this true, and are there any recent articles supporting negative impact of excess protein? I suppose the key thing is really then distinguishing between animal protein and plant protein as well.
Yeah, I suppose the risks are, the increased amount of saturated fat if it's coming from animal protein, and also the damage that it's doing then to the gut microbiome as well. With the reduction in fiber, if you're eating more of the protein, and if it's coming from animals, then there's less fiber going in, essentially. And the KDIGO guidelines that I mentioned, they do give guidance on protein, but it's a little bit more complicated, and would require guidance from a dietitian. In the States and in Europe, they use very low protein diets with keto acids, so providing amino acids to ensure that you avoid any sort of malnutrition, and that can help slow down the CKD progression. In the UK, we don't use that. We tend to be quite in line with the adult recommendations of 0.75. Sometimes we might go slightly lower, but certainly wouldn't go high. If somebody was malnourished, if they were unwell in an acute environment, then that's the time that I would use a higher protein. But in the community, when somebody's fit and well and they're just managing their CKD, then no, I wouldn't use those sorts of levels. They sound, I don't know the research, I don't know the evidence for them, but I certainly wouldn't use them.
So someone's also asked about feeling full and bloated on a whole food plant-based diet. Sometimes that's also due to just the increase in fiber, and it's important to transition sometimes gradually, increase that gradually, but they're finding it hard to eat the required amount of calories per day. I just want to highlight that we have got a fact sheet on how to gain weight or how to get enough calories on a whole food plant-based diet. And that is available in the fact sheet section. I know that there's lots of new people here tonight. I see a lot of people who aren't.
Yeah, I've seen that fact sheet. That's very good. And I've also seen another fact sheet that you have on how to deal with sort of IBS type symptoms as well. Am I right? Yeah.
We have a few different fact sheets. We have one on IBS symptoms, and I've done one on how to reduce bloating from legumes and which is sometimes quite a new food group that some people haven't been including in their diet before. So there's lots of different ways that you can manage this. So don't give up hope.
No, absolutely not. Don't, and perhaps just take a slight step back and then start to build up again gradually. So
I agree. And we have tons of free resources on our website, but if it's something that's ongoing for you, then there is also a directory with nutritionists and dietitians and things who understand a plant-based diet that may be helpful for this person who's asked this question. But I would recommend checking out the free resources first, because they're obviously more accessible.
Likewise.
A raw vegan low-fat diet, and if that's suitable for CKD for someone who needs to limit dietary vitamin K and potassium.
So a raw vegan low-fat diet, I think it would depend completely on the circumstances. It's not one that I would normally recommend. It sounds like it might be sensible for them to seek support from a registered dietitian or a nutritionist. If it's specific to CKD, a kidney dietitian would be appropriate. It would completely depend on their individual circumstances, the stage at which they're at, and their blood results as well.
Definitely, thank you for that. A question about coffee, which you briefly touched on, is decaf coffee still high in potassium?
It is, yeah. So it's not the caffeine, unfortunately. Yeah, it's the same with things like milk. A lot of people say, well, I use skimmed instead of full fat, so it's still high in potassium. So that's not where the potassium is. Yeah.
There are some good kind of coffee alternatives in health food stores as well, and things sometimes if someone's really missing the taste, something that kind of can mimic.
So I never say to completely avoid. Yeah. So you can still enjoy it. I think it's hard for us to say completely avoid, but a lot of the times it might just be limit those things and enjoy something else instead.
Yeah. Finding another warm drink that you enjoy as well. But yeah, I totally agree with that. The question from someone asking, how essential is it that a patient on dialysis changes their diet? As treatments are so regular, can patients avoid making changes?
Yeah, so again, it's very individual. So anybody that's on dialysis would see a dietitian frequently. So I look after 2 dialysis units. I go to one of them twice a month and the other one once a month, just because one's smaller and one's larger. And so I see all the patients frequently. So at least once every 2 months, they're seen for support with their diet. We monitor their bloods really closely. Some patients don't need to make any changes at all, and others have to make quite significant changes. So the one thing that they do need to do, which can be a bit of a difficult shift if they've spent a long time keeping their protein down before dialysis, is they would have to increase their protein once they're on dialysis. So dialysis is very good at cleaning the blood and getting rid of all those toxins and that waste, but unfortunately as a byproduct it also takes with it essential proteins as well. So we need to put those proteins back in the diet. So anybody wanting to follow a plant-based diet while on hemodialysis or peritoneal dialysis or any of the types of dialysis, it's important that they just get support from a dietitian so that they're ensuring that they're getting sufficient protein in the diet. It doesn't mean that they can't follow a plant-based diet. They'll just need more guidance on how to do it.
Super. And one final question before we wrap up. Are there studies showing that plant-exclusive diet is better than a Mediterranean or plant-forward diet for CKD?
Good question. I'm not entirely, I wouldn't like to say 100% which studies they are. There are some studies, but when they looked at the KDIGO guidelines, they didn't feel that the studies were strong enough in evidence to to suggest exactly what protein type to use. Does that make sense? So to recommend plant over animal protein.
Okay, yeah, I think there have been some really good studies on plant, like showing a plant-centric diet. Obviously, it's difficult always with anything to kind of pinpoint, should it be 100% plant exclusive or 95% plant exclusive, but I think given everything that you've talked about today, it's quite clear that kind of shifting towards eating more plants or more whole plant foods is going to be beneficial. Would you agree with that sort of statement, and that including more plant protein like beans and lentils and tofu and tempeh over a lot of meat products? And
I mean, often we're just trying to get people to eat more than 2 portions of veg a week. So yeah. So
yeah, that's quite a niche question in a way. And I suppose a lot of people here today want to kind of have had that reassurance that you can thrive on a plant-based diet, and if you have CKD, it's possible to see it.
Oh yeah, no, absolutely. There's no, I'm not saying don't do that, but yeah, absolutely. If you wanted to go down that route, absolutely, that's fine. I think it's worth, depending on what level, what stage of CKD you're at, if you're having a 100% plant-based diet, it's worth getting advice and guidance on your supplementation of vitamins and minerals.
Yeah, that's really good advice. Okay, well, there's been some great questions we couldn't get around to, but there's also been lovely comments from everyone saying excellent presentation, such a great talk, informative and interesting. So
I'm sorry it went on so long.
Very information packed, definitely. It's a really nice comment. So thank you everyone for sticking with us, and thank you, Angeline, for a great presentation. And I will see everyone back in September for the autumn program. So we're going to be signing off for a little summer break, but I hope you all have a lovely summer and see you soon.